Dr. Richard Buckley here at MilfordMD. Usually it's good morning. This is good afternoon, right? Good mid-Friday afternoon. So our patient, as with so many people, has suffered with acne. I don't know what the deal is. We should make some law and ban acne for good, right? Propionobacteria acne, or P. acne, or just acne for short. It's the nickname of the bacteria. It's like we're on a first name basis with it. Right? Not good. So, you know, acne over time, depending on the skin type and, you know, how inflamed things are and a bunch of other factors, can leave some scarring. The scarring over time can be white, or it can be red, and can be dented in. There are different kinds of scars that can result from that. Some of them are kind of pokey and known as ice pick scars, and some of them are kind of undulating, so they're rolling scars, and some of them are sort of rectangular in the shape, so maybe we call those boxcar acne scars. And at the base of those scars, the scar tissue is often pulled down because, you know, scarring is a process of things contracting. So in their depth, they shrink down like this, but that makes a dent on the surface. So one thing of many things, multifactorial things, synergistic things that can be done to help with acne scarring, is to sever, that is to say, release those scarred fibers that are underneath, a process called subcision. You numb the area and then release those scars. That's something, if we feel it would be helpful, and it very often is amazingly helpful, that's something that we would do just once typically. And in fact, the scarring is often so tough under there, you can kind of hear it go twang, a little clicky sound when it releases. It's very gratifying and satisfying, and sometimes even instantly pretty amazing. That's one thing. Next thing is, not only underneath the skin might there be this pulling down, but within the thickness of the skin, which is always, you know, fairly thin, even where it's thick, there could be some contracture and some shrinkage in that area. So the question is, how do we expand that area? And we can expand it different kinds of ways. We can expand it with synthetic fillers. The hyaluronic family is a nice group to work with, like the Restylane family. And we can also expand it with one's own normal autologous, that means it's yours, autologous cells. And so to that end, you know, fat transfer is very nice. And if we want to be able to take fat cells and the components of fat cells, that is to say the cell walls, which are made of collagen, if we want to take that material and do some very fine work with it, then instead of having microfat, which is what we normally wind up with when we do our liposculpting, liposuction, we need nanofat. Nano is even smaller, you know, like nano, right? So we, no, you're shaking. We make, listen, it's Friday, give me a break. So we make nano fat, we size it and size it and size it, and then eventually put it through one of these tulip nano fat makers. And I could actually pop the top and show you. There's a special filter here to knock it down to 600 microns. Now I'm leaking out the bottom, I feel it even through my gloves. So I have made up some syringes of nano fat, and then one of the neat things, I'm sure our patient will be very excited about this. One of the neat things about nanofat is it will go through some of our very tiniest needles, right? So the tiniest needle you might use for a filler, say what we call a 30 gauge needle, which is really tiny, the nanofat will go through that very nicely. So turn your head that way for me, and you know, if one were to shine the light sideways on the skin, which I have done, and that's the best way of seeing undulations. If you shine light right on something, the bright light kind of flattens things out, and then you don't see the undulations from the side. That's why if you look at an old Boris Karloff, like scary movie, woo, the lighting is either from the top or from underneath, and then you see, you know, every little chiseled bit of that scary-looking person's face. So normally we don't want to do that, but if we want to show up blemishes, then we do that. And then I've made all kinds of little marks in red here to help me even see better what I'm going to do with my nano fat. So this is numbed here, and in a moment I'm going to run around putting nano fat in each and every one of those little marks, and plus I have on 3-power magnification so I can kind of blow things up and see even more details. After I've done that, I'm going to pop under the skin through the little point right there and then just do some subcision. We may want to, and our patient can elect to do that or not, do some laser skin resurfacing. So the subcision is going to take care of things or improve things that are under the skin, so-called subcutaneous layer. The nanofat is going to help improve things within the skin itself, the dermis, epidermis and dermis. And then the surface of the skin would love to be polished and tightened everywhere and smoothed out. And that is probably best done if one has the appropriate skin type for it, which would be lighter skin tones. Fitzpatrick's so-called skin types 1 through 3, I would say, would be ideal candidates for this laser. And that laser is a CO2 laser, carbon dioxide laser, which is at 10,600 nanometers. It's a little bit beastly, and it is ablative, which means it vaporizes skin, but if there's skin that we don't want and depressions that we don't want, then maybe it's nice just to vaporize the issues and craft that vaporization so things are smoother, tighter, nicer. You can look maybe 3 weeks ago at a video we did of a staff member, a CO2 laser, so you can see that intra-procedurally. Here we're intra-operative. You're awake?
I am.
And smiling and excited and comfortable. You know, you were, I think, a little nervous when you came today, but you seem more excited now than nervous.
I am.
You are?
Yeah.
Okay. All right. There you go. We moved from a little nervous to looks pretty excited to me. I'm excited too. And it'll be fun to see the progress as we move along towards being better and better and better. Yeah. And so sometimes when people when they get older, they want to look younger. All right. So a lot of what we do is helping that to take place, right? Some people, such as our lovely patient today, she's plenty young enough. I don't even know exactly how young she is, but I know she's like super young, right? And so the issue isn't making her look younger. The issue is helping her be a better version of herself, even at the age she is now, right? So there's always something to do one way or another to help people be more confident, be happier, right? So maybe I'll bring you back a little later and show you a bit of something. So thank you for watching MilfordMD.